Mandible is a bone of lower jaw. So it is the largest and the strongest bone of the lower jaw. So the mandible is a shape like a horseshoe shape having a two parts. This is the body of the mandible and the two ramus. So this is the ramus of the mandible. This is the body and this is the ramus. Now one by one we are going to discuss about the body and the ramus of the mandible. So the body having a two border, this is known as the superior border or the alveolar process which bear the socket for teeth. So this is the upper border, superior border या alveolar process, and this is the inferior border of the body of the mandible. So the inferior border also known as the base of the mandible. In the midline, in the inferior border, there is a shallow depression. This is known as a digastric fossa, and this digastric fossa is provide the attachment for the anterior belly of digastric muscle. So this is the inferior border and the base of the mandible, and two surface, this is the external surface of the mandible, body of the mandible. This is the internal surface of the body of the mandible. Now the external surface of the body of the mandible having a one oblique line which is continuation as the anterior border of the ramus. So this is the oblique line. The oblique line of the body of the mandible provide buccinator muscle below to the third three molar teeth. So this is the buccinator muscles and the anterior part below to the mental foramen. This foramen is known as a mental foramen, which provide the two muscles, that is a depressor labia inferioris and the depressor anguli oris muscle. Okay, so this is the oblique line, and in the both side you can see there is a foramen. This is known as a mental foramen, from which this is the mental nerves and vessels are passing through this foramen. Now in the midline, so this is the two mandible, body of the mandible. At the age of 2 years, these two parts fuse in the midline from the mental symphysis, and the lower part of the mental symphysis having a triangular impression, and the lateral margin of a triangular impression is known as a mental protuberance, and there is a limited by a tubercle. This is known as a mental tubercle. So this is the mental symphysis, this is the mental protuberance, and this is the mental tubercle. Okay, and this is the in the midline. This is known as the incisive teeth, incisor teeth. Below to the incisor teeth, this is known as the incisive fossa. So in the incisive fossa, there is attachment of mentalis muscle and the mental slip of the orbicularis oris muscle. So this is the incisive fossa. So this is the external surface of the body of the mandible. Now the internal surface. So this is the internal surface of the body of the mandible. In the midline, that is along with the mental symphysis, there are the four tubercle, two inferior tubercle and the two superior tubercle. This is known as a genial tubercle. Okay, the upper two, that is one pair which provide the attachment of the genioglossus muscles, and the lower tubercle, this is the lower genial tubercle which provide the attachment of geniohyoid muscle. So in the midline there is a four genial tubercles are present, two on right side and two on left side. Okay, now the another line, just like a oblique line, there is another line known as a mylohyoid line. The mylohyoid line started from behind the third molar teeth and extend up to the genial tubercle, yeah, below to the genial tubercle. This is known as a mylohyoid line, which provides the attachment of a mylohyoid muscle. Above to the mylohyoid line, in the anterior part, there is a small depression, a fossa. This is known as a sublingual fossa, which is the sublingual gland. Whereas in the posterior part of the mylohyoid line or below to the mylohyoid line, there is another fossa. This fossa is for the submandibular gland. So this is known as the submandibular fossa. Okay, so this is the inner aspect, and below to the mylohyoid line there is a groove is present. This groove is known as a mylohyoid groove, which provide the passage for the mylohyoid nerves and vessel. Okay, so this is the inner aspect of the body of the mandible. Now the ramus of the mandible. Okay, so this part is known as a ramus of the mandible. The ramus of the mandible having a four border. So this is the posterior border of the ramus of the mandible. This is the interior border of the ramus of the mandible. This is the inferior border of the ramus of the mandible, and this is the superior border which form the mandibular node. So this is the superior border of the ramus of the mandible, and having two process. The anterior sharp process is known as a conoid tubercle, where is this expanded part is known as a condylar process. Okay, and having a two surface of the ramus, that is a outer surface and the inner surface. Now one by one, the outer surface of the ramus having a oblique ridges on the lateral surface or the outer surface. These oblique ridges are the for the attachment of the masseter muscle. Okay, whereas the inner aspect you can see there is a one fossa. Okay, this is known as a submandibular fossa, which is continued as a submandibular canal, which open in the outer surface of the body of the ramus as a mental foramen. Okay, so this is the submandibular fossa or the submandibular canal, which lodges the from the submandibular canal. There is a passing structures are the inferior alveolar nerve and the artery. Okay, and the anterior part of the submandibular fossa, there is a tongue like structure. This is known as the lingula. Okay, the lingula which provide the attachment of the ligament known as a sphenomandibular ligament. Okay, one thing is remaining. So in the oblique line, so mylohyoid line, above to the mylohyoid line, there is a attachment of the superior constrictor of pharynx. Okay, so this is the inner aspect of the ramus of the mandible, and one thing at the angle of the mandible, that is at the posterior border and the inferior border, this is junction known as the angle of the mandible. So in the aspect of the angle of the mandible, there is a rough area. This rough area is provide the attachment for the medial pterygoid muscle. Okay, and this angle of the mandible provide the attachment of the one ligament. This is known as a stylomandibular ligament. Okay, so now the two process, that is a conoid process and the condylar process. The conoid process, this is known as the conoid process. So anterior border, tip of the conoid process and the inner surface which provide attachment of the temporalis muscle. Okay, now this is the condylar process which is expanded side by side. Okay, so this is now the head of the condylar process. This is the neck of the condylar process. So on the anterior surface of the neck of the condylar process, there is a small depression. This is known as a pterygoid fossa. Okay, so this pterygoid fossa provide the attachment of the lateral pterygoid muscle, and this condylar process form a joint that is known as a temporomandibular joint, that is a condylar variety of synovial joint. Okay, and the lateral surface of the this neck of the condyle which provide the attachment of the temporomandibular ligament. Okay, so this is all about the mandible, that is a bony feature, and the attachment of the mandible. Thank you for watching this video.